Jeff Means is an entrepreneur with healthcare revenue management, RCM, automation and AI-driven innovation. He's a pioneer. You're a pioneer? You wrote this? In particular with full autonomous solutions that deliver meaningful production and quality improvement. For over the last 20 years, he has led projects that have delivered over $1 billion in client benefits through AI-powered solutions to the market. He is currently the co-founder and CEO of Longtail Health Solutions, using generative AI to change paradigms and clinical denials in utilization management. That is a long sentence. You should have looked at. I should have edited that for you. Jamie Harrell is a Senior Director of Finance for the Surgical and Procedural Services at the University of Oregon Health and Science University. Jamie has been with OHSU for over 19 years, holding many posts of finance in over the past 13 years, operational finance. Jamie has focused on the surgical services space in recent years and assisted with multiple projects using reimbursement improvement, as well as effective efforts from the beginning to the end of the patient care at the university hospital. I give it over to them.
Volume check, is this gonna work?
Check, check.
All right. All right. I'm Jeff.
Jamie.
And Jamie. Whenever the slides are ready, we'll get going. But do you want to do a little survey, a little check of the crowd? AI competence?
You know, my first question to the group here is, who likes Bandit Dunes? That'll be the first one, but we'll save that actually for later. Who in here really feels they know AI?
Can anyone spell AI?
Can anybody? Good one.
All right.
All right, who thinks AI is going to steal their job?
Your boss is watching.
This is very true. Jeff is definitely going to cover this, and I will tell you, Jeff is the absolute genius. I was just talking to one of his coworkers a moment ago. He could be AI. I haven't really gotten to the bottom of that just yet. But he's going to lead all this. I'm just here to throw in some jokes along the way and see if I can throw him off a little bit as we go. And if you've been to an Oregon chapter event and you've heard me speak, you might hear some similar jokes. So I apologize ahead of time.
We'll get into it. You got our intros, the blah, blah, blah. For all the intro, I'm not an engineer. I don't have a degree in engineering, but I'm around AI a lot. So we'll talk about AI from more of the practitioner's perspective. When you leave, hopefully you are much more equipped to make decisions, pick the right use cases, pick the right vendors, prioritize. What should we do today? What should we wait another year or two before things mature? Hopefully everybody leaves feeling comfortable having conversations with your boss and with your staff about making AI decisions and implementing and using. That's the point for today. I will try to leave as much time as I can at the end for questions, so get them ready. If we're going too slow or too fast, give us the feedback along the way, especially if you need me to slow down on something. I will talk.
You'll definitely know how to turn photos into babies before we're done.
Yep.
Or cartoons, which is probably where I sit better.
The most mature use cases in AI today. Okay, let me problem statement here. People have been throwing around the term AI for a very long time. People started using the term AI in about the 1950s. So this is not a new concept. People for decades have been calling their software products artificial intelligence because they think they will sell more software if they do that. And it's created problems for people who can't understand, how does this product work? What is it doing? How do I use it to the best of my ability. And so you end up with problems like we invested a ton of money and time and resources into AI and automation, and we've gotten results that are embarrassing to tell the boss about. This is a problem. There's also those claims about you should expect X because it's doing such and such, and those expectations aren't always fulfilled. And so we're at this point where everybody's saying AI, AI, AI. Most people's bosses are saying, what's your 2026 plan to use AI to reduce headcount or reduce vendor spend or collect more cash or do more with less, whatever scenario. And people are being asked, what is your plan for next year? And the answers are, I'm going to use AI. AI is the answer. This is a problem. So hopefully, when we wrap up here, you'll be in a better position to answer those questions. Okay. I'm going to put this on my tombstone. I think I coined a phrase. It was like a lifelong goal for me to coin a phrase. So, and I think this is true. Automation gain is the term I want to use for how you should measure the success of an automation project. And you can't just simply say, well, we put in this new process, we put in this new tool, and so we're collecting millions of dollars more. That's not a great way to measure it. You should say, what is the cost of implementing and using that new software, and how much time savings am I actually harvesting? Not what the projections were before you started the project, but how much time savings am I actually harvesting? That is the net savings. You can't, you have to include the cost of the transformation in this. I think this is the best way to measure the automation. Let me do an illustration. I've made a career out of dogging. I know Waystar's in the house. Dogging bots to do claim statusing because it is a great use case when done right. It's a horrible use case when done wrong. And it's a great way to illustrate this, like the problem. People may just start with what is the process. This is an oversimplified illustration, but let's map out what the process is. We do thousands of claim status checks a day. If we could automate that, we would save thousands of hours. And so you draw out kind of a hasty, what does the process look like? This crux, we log onto a web portal, check the status, and do something else with it afterwards. There's thousands of times we could just not work the cases. There's thousands of times we could automate the next step, et cetera. Let's spend a bunch of money, implement claim status bots, and all the problems will go away. And people do this, and there was an oversimplification, and they actually don't harvest any automation gain, any net savings, because they didn't actually map out the real process. They didn't map out what is the future process that uses the automation to actually to save person minutes of time. And so this is a more sophisticated, this is obviously still not the full thing, but the idea here is that just automating the claim status check will only save you a minute. And if you're not redesigning the workflow to harvest the information that you gained, you actually don't achieve the benefits that you were looking to do. You need to actually revamp your work queues to harvest, well, we have the data point that says it's set to pay, take it off everybody's work queues so that nobody goes and touches that case. You need to escalate your denials. A no claim on file issue is totally different than denied for specific reason X kind of thing. So the point here is when you're starting on these programs, you need to do a good job understanding your as-is process, because it doesn't matter how sophisticated the new software is that you're implementing. If you don't have a new process on the other side of that transformation, you won't harvest the gain. Okay. All right, let's get into nuts and bolts. What are the tools available to you today? The hot topics today, when most people say AI today, they're talking about large language models. I'll come back and do a deeper dive on how large language models work. This is your ChatGPT and Gemini and Copilot and whatnot. It's the hot topic of the day, and when people say AI today, usually they mean LLMs. 3 years ago and prior to spring of 2023, when people said AI, pretty much they meant predictive models and machine learning. A predictive model is actually pretty simple. I mentioned AI started in the 1950s. The math was all worked out in the 1950s. The process was all worked out in the 1950s. We just didn't have computers with enough processing power, and we didn't have enough data logged in computer systems to use it. Here's what a predictive model is. You collect a bunch of data from observations, past performance captured digitally. You run statistical analysis to draw some conclusions about the past performance. Those conclusions, now you take them and you have a new instance, a new observation, and you apply the conclusions from the historical data to predict an outcome for this one new case. This is a predictive model. It is great for certain things, and it's lousy for certain things.
And it's great for fantasy football, right?
Exactly.
Yeah.
It's very useful.
And for the
You can make
sports
money
book
doing
here in
this.
the casino, if anybody's wondering.
A really good revenue cycle management use case is managing patient balances. This is actually the first really good use case that I observed of using predictive models. Here's what you can do. You can, I'll give you the answer. When you draw the correlations on collections performance, it's basically zip code and employment status is how you predict if someone's going to pay their copay or their deductible. That's pretty, there's other factors, that's pretty much it. And you'll come up with something like, Jeff is 60% likely to pay his copay, and Jamie's like 10% likely to pay his copay.
True.
And what you can do with this information, you're probably not going to treat me any differently through the process until you get to the point of sending statements. What you can do is you can take your populations that are likely to pay, and you just send them statements. And you take your populations that you think are less likely, and you can engage a proactive conversation at different points in time to engage the different options, the payment plans, maybe there's a supplemental source of insurance, et cetera. And the idea here is that you can segment the populations. Let's do it differently. Let's say that Jamie and I both live in the same zip code and have the same employment. Now it's really hard to distinguish. The process is going to be the same for both Jamie and I. And here's where you hit your limit with predictive modeling. If it's 50%, you don't know which one of us is going to be the one to pay their copay and which one isn't. If you could actually predict with high accuracy that it's Jamie who's going to pay and not me, now you can do something different, like I'm not going to bother to send the statements, I'm not going to bother to make the phone calls because I'm never going to collect from Jeff, but I will make the attempt with Jamie because it will be effective and I will get the result that I was looking to get. This is how you use predictive analytics. This is the right way to use predictive analytics. Let's take it one step further. Anybody want to take a stab? What's the difference between predictive modeling and machine learning? Any brave souls? I know there are people who have heard this from me before. I'm looking at Carrie. I told her I was going to call her out. Okay, here's the difference. Just go one step further. Every time you have a new observation, you make your prediction about that observation. Jamie's going to pay his copay. And you add as much richness of data as possible. When did I have the conversation with Jamie? Was it written or verbal? Was it in person? What timing was it? You add all of the data points that you couldn't add when you were doing your history. You add that in, and now you can, every time you build a feedback model, I predicted X about Jamie, I collected all this extra data, and then Y was the real outcome. Every time you have a new observation, you can make that model just a little bit better. Machine learning is predictive modeling. It's just you add a feedback mechanism so that it gets better over time.
Jeff, this is an area that, as a healthcare system, we're running into now with the roadblock of AI governance committees
Yes.
and governance groups that may or may not be experts, but they need to be the experts. This seems to be an area that is their biggest challenge of protecting that data. What do you say about that? Not to get you off topic.
Yeah, it's a hard question. In general, I would say health systems protect your data, and you're naturally going to have to use outside vendors to support you in different ways. And those vendors have built their systems to operate a certain way. They need access to certain data to be able to run their programs. And so you ultimately have to make a decision. Do I want the outcomes that that program offers? And am I willing to, you can always add caveats about limitations of use. And generally, most software providers really just want usage data so they can make their products better. Really, most products that are out there, they're not trying to capture your patient data so they can, there's claims aggregators and stuff like that that do this, but I wouldn't say it's the first. I guess here's my advice about AI governance committees is they should be there to protect the organization in their decision making, but they shouldn't be there to always say no. The answer should be, here are the effective controls that need to be in place for us to move forward, as opposed to the answer is no. If the answer is always no, you're burning too much time. Good stuff. All right, let's keep going through our toolkit here. Is RPA, robotic process automation, is this AI? Prior to 2023, with the language model revolution stuff, all of the RPA companies were calling themselves AI companies. The argument here is inherently a lot of these tools use image recognition or character recognition to get the bots to click the right place on the screen, and those are derivations of predictive models. And so this is why people would call it AI. I go either way. It's not an AI. It's AI enabled, I suppose. These products are getting better. They will continue to get better using the new models available with LLMs and such. Essentially, RPA is teaching a computer to mimic the keystrokes and mouse clicks that a person would do. It's really good for a simple process that you perform a bunch of times. My first use case was around claim statusing. That is a great application for RPA. And like I said, you want to make sure that the bots are working side by side with the staff in an integrated way, because otherwise the people will just repeat whatever the bot did or not trust it, etc. Okay, questions along the way? Keep driving. I would say don't throw out the old toolkit to just adopt the new stuff. If you're engaging a project and one solution is like a silver bullet solution with, we're using AI, and so we have this silver bullet, it's probably not a good product. Integrating the variety of techniques that have been developed over the last 30 years and using them in conjunction with each other. I call it a toolkit because these things work together. A hammer is really good at hitting nails, horrible at turning screws. And the nail, it has a specific purpose. It is a slightly different purpose than the screw. And so use the tools for what they're good for. There's still a place for business rules management. There is still a place for interfaces. There's a big place for interfaces, and you should always use business intelligence. You should be tracking everything that you should do. These things need to work together. They're not standalone things. If they're standalone, they're not efficient. If the product uses all of these things together, they tend to be better products. All right. I said I would do a deeper dive on LLMs. This is the hot topic of the moment. Raise your hand if you are using ChatGPT or Grok or Gemini on a daily basis. Awesome. Keep your hands up if you're saving at least an hour a day using these tools. Good, good. Keep your hand up if you're saving at least 3 hours a day. I don't think I'm saving 3 hours a day. Awesome. The answer, this is where it's going. If you didn't raise your hand at all, kind of Jamie's point at the beginning, you probably will lose your job, not to AI, but you probably will lose your job to somebody who knows how to use AI. If you don't use it, you're not going to lose your job to AI, but you might lose your job to somebody who knows how to use it. And you should be playing with these things. You should be using these things every day. And start by playing with it. Start by planning a vacation, getting a recipe. Start there. Maybe you go deeper. How do I talk to my son about the trouble he's getting into? You can go deeper, and then when you start to get good at these tools, then you can say, how do I deal with this uncomfortable issue with my boss, and how should I do my annual planning for what we're going to do in 2026, etc. Okay, LLMs. Here's how they work. Step one is to go get a ton of written data. All of the New York Times articles ever published, every tweet ever published, every tweeted? Is that?
Tweeter? Twits.
These things. Every post ever on Facebook. These are huge repositories of written text. And it's called a large language model because you use the statistical principles in the predictive modeling, you use the statistical to build a model. It's called a neural network, and essentially it is how in 7 billion different ways, how are all these words related to each other? It is a model for how human language is used to express things. At a nuts and bolts, it's more complicated this, but at the nuts and bolts, what you're doing is you're saying, predict the next word, and then predict the next word, and then predict the next word. I'm going to do a little practical exercises, particularly the people in the front who can see me well enough here. The way it works is there's a prompt and a completion. A prompt is you telling it what you want to do, and then the completion is ChatGPT or whichever system finishing the sentence or finishing the prompt. Okay, so here's the prompt. Jeff's eyes are, and then you guys fill in the rest. Lovely. Thank you, Carrie. Okay, most people would say Jeff's eyes are blue, if you can see, because, and this is how an LLM would work, is we have seen this type of language structure many, many times, and I'm predicting blue because most often when people say a sentence like that, they're talking about the color of somebody's eyes. They use context, though. It isn't really just predicting the next word and the next word and the next word. It is a little bit more complicated than this, and you can give more context. And so if you were giving context like Jeff is coming from a doctor's appointment, an eye doctor appointment, then maybe you would get maybe the completion would be more like Jeff's eyes are dilated, or Jeff's eyes are nearsighted, or farsighted, or I'm middle-aged, so I'm kind of both. This is how they work. The more context you will give it, the better it can predict the completion, the better job it will do of finishing the thought for you. So as you go home, if you get bored here, if you're doing it on your phone, as you use ChatGPT more, you should be getting better at giving it more context, giving it more guidance, because it will do a better job with the completion. The response to what you're asking to will get better at time. Okay, it is great at predicting the next word or phrase. It's great at summarizing. You can input an article and ask for a summary to save time. It's great for, I drafted an email and I want you to make this email more effective. I'm giving a presentation about AI. Give me some suggestions how to make this more punchy. I'm telling these jokes to my teenage kids and I want them to use skibbity brain rot when I'm talking. Actually, if you have teenagers, you should be doing this so you can talk to your teenagers better. But it's actually great at anything that's language-based. Here's the problem at the end here. It's called the large language model. It's called artificial intelligence. It doesn't actually know the meaning of those words. It's not trained in the meaning itself. It is how do people historically typically use language in a flow. It doesn't know the meaning of those words, and so it can predict things that actually don't make great sense at all.
Yet.
Not yet. Not yet. So it doesn't understand. Okay. We will come back. We'll come back and go a little bit deeper on LLMs to the extent there's time, and we'll leave some time at the end too if you want to ask questions about those things. I'm not going to go through all these just for the sake of time, but these are some of the buzzwords that you're hearing. At this point, the Geminis and ChatGPTs are getting so good that people aren't using the buzzwords quite as much anymore. It's getting to the point that you can just go to the text box and just start typing, and it's surprising how good the interaction is and how well it understands what you're trying to do. The one I want to call out here at the bottom, reinforcement learning. This is the modern version of machine learning. Reinforcement learning is that feedback mechanism, the loop, so that every time you're using these tools, they get a little bit better. I'm flagging this because any products that you're looking at implementing should be healthcare specific, and there should be some level of reinforcement around the specific use cases and the specific topics that you are performing. I think the other one, just to hit it briefly, is agentic AI. We can do a next conference or whatever. We could do a whole session on agentic AI. My personal point of view here is that the agents are not ready. So if you are evaluating agents, I would for sure demand a live demonstration of the agents. I would ask for, let's get under BAA and let's use a specific example from my organization, and I want to give you my example, and I want to see it process in yours. This way you know you're not getting a hardwired demonstration that isn't the actual product itself. My point of view here is that the agents are not product ready yet today. There may be folks in the room who are further along on this than I am, and when we do Q&A, let's bring up those examples and let's talk through what's ready and what's not. Agentic AI is just simply whenever there is a decision to be made, allowing that system to make the decision itself. Sorry, I'm going to go one more riff on this. I watched the ChatGPT demo when they started introducing their agents, when they did their web release of the new product. And Sam Altman is in this live demo, and they're getting ChatGPT to do vacation planning, and Sam Altman said something like, "Well, I wouldn't trust it to actually take my credit card and book my airline vacation for me," which I think is wise. My point about the agents are not quite ready, and honestly, it took a lot longer for them to do their demo on planning a vacation and booking a vacation than it would take you to just go to AmericanAirlines.com and book the darn vacation yourself. So this is my point about I don't think the agents are quite there. It is what's coming over the next couple of years, and so you will hear agentic AI, and it's just simply we have a workflow and we allow the system itself to take action. When there is a decision to be made, we let it make the decision and let it continue the workflow itself. Okay.
Hey, Jeff, why are there iterations? Like ChatGPT is a great example of, you have ChatGPT 5, I think we're at now.
Yeah.
And will that eventually end and it'll just be ChatGPT?
Yeah. I don't know when it ends. I think 7. You think this will be the last one?
Oh, wow. Breaking news.
Yeah. I think, okay, predicting these things is dangerous. It's less dangerous to predict the weather. ChatGPT came out several months later than the original expectations were set. When did Elon Musk say that the majority of vehicles on the road would be self-driving? He said, the first time I heard him say it, he said the majority of vehicles on the road will be fully self-driving in 5 years. Today, lots of cars have self-drive capability. Almost zero are self-driving like on a regular basis here. He didn't say this 5 years ago. It was like 2008. It was a long time ago. So I'm not going to make a prediction about which, when will GPT-7 come out? How much better will it be? These things are going to keep getting better. I do think that there's a natural ceiling on how good they can be. Like I said, the weakness of LLMs is that they don't actually understand the words. They don't actually understand the meaning. It will write an article. It would write this presentation. If you give it good context, it will write. It does not know what any of those words mean. It does not know what it's actually saying. So there is some sort of limit, and it'll keep getting better, but each next increment, it won't be as big of an upgrade as the last increment. That's a hard one. Let's come back to it in Q&A if you guys want to go deeper. Let me give you a framework. Okay, here's my framework for automating in general. The first thing you should do, I gave you a little flow chart. You should go and map. You need to take the clipboard and the pencil down to the basement, watch people do their work, and actually flow it out. Make sure you understand all of the work steps. At each work step that you're considering automating, you should evaluate how complex is that task. In general, the more complex it is, the more expensive and less likely for success your automation initiative is going to have. Real quick, a sequence, real easy to automate. If you're doing click here, then click here, then click here, then click here, you should build a bot and have the bot do it because it's cheap, it's highly effective, it's going to do the same thing every time. When people say that RPA makes errors, it's because the program didn't cover all of the exceptional use cases. It's because they didn't program all of the different paths that were possible. Bots are extremely reliable. They do the same thing every time. If it's just follow the recipe, if you follow the recipe with the same ingredients, you will get the same cake every single time. If you have a burnt cake, it's because you didn't follow the recipe. The computer is not going to make a mistake following the recipe. A business rules matrix. Some decisions are not just a yes or no decision. Sometimes you have to use a more complicated set of rules to make your decision. A great example, registration folks will use a cheat sheet to pick the proper plan code. Maybe there's 4 different Blue Cross plan codes in our instance of Cerner or Epic, and it's actually important to pick the right product because it has billing implications and authorization implications. So I have a cheat sheet pinned to my cubicle wall so that I pick the right one when I do the registration. This is a business rules matrix. If you can put it in a grid that you give to your staff to follow, you can digitize that and put it into a computer system. If you could write it down, if it's simple enough to write down, it is simple enough to bake it into a computer system. And like I said, the computer's going to make the same decision every time, highly reliable. Okay, the problem is life is not a single sequence of events. There's always decisions to be made, and it's usually a sequence. So when bots fail, when programs break down, it's usually because the decision tree had 20 branches, and we only built our workflow, we only built the system to handle 10 branches of the decisions. And this is my point about going through and watching the process as it is today and documenting that so that you, before you embark on an automation, you actually capture that complexity so that you, maybe you're not going to try to automate every branch of the decision tree, but you can be smart about how many are there, how many exceptional cases are there. It's really important. The expense is not because making the decision with a computer system is hard. It's because capturing all of the branches that are available, that's what gets expensive. That's what gets fixed. I would actually attribute, that opening statement about most AI projects fail. I would say this is where I would attribute the most failure is underestimating the complexity of healthcare administrative processes means you didn't You didn't pursue the project well. Okay, the last one are cognitive decisions. When you need to input a bunch of information and then use some sort of judgment or experience to make a decision, these are difficult. This is why you have staff. Hopefully, you are escalating the ones that require judgment and experience. Hopefully, that's what your staff are spending their time on. LLMs, again, they don't know the meaning of those words. LLMs do not have any judgment. They don't have any wisdom. They are not great decision makers. It's great at trying to please you. It is not actually a wise decision maker because it doesn't have experience. And so here's where I would segment it. If it's simply make a decision, analyze these words and make a decision, an LLM is a great agent, is a great way to do that. If it is from your experience, having interviewed many patients about if they're Medicaid eligible, make this decision. No, you should send that financial counselor up to the floor and not ChatGPT up to the floor. Okay, it is a continuum in complexity, and in general, the more complex, the more expensive it is to automate. Let's just take it one step further here. Same horizontal is complexity. Now the vertical, though, is how many times do you do that task in a given day? If you do that task over and over, you're in the top left quadrant. It's highly repeatable, and it's simple. You should be implementing software to automate those tasks and processes. The far extreme would be if you only do it once a week and it's really complicated, that's why you have a financial counselor. That's why you have a manager. That's why you have a physician advisor. That's why, right? Like that's the highest skilled people that you have. That's why you have them. They should be handling the most complex cases, and they should be juggling a variety of different types of use cases. Here's the problem with the world. The problem with the world is all of the green stuff is gone. When you go back to work next week, you're going to be saying, what are my use cases that are top left green corner? There aren't very many of them. The reality is you've already done a nice job of engineering your processes that the most efficient things to automate, they've already been automated. The yellow areas are where we live today. And so real quick, there are two techniques that you can use to turn something from yellow into green. Let's start with on the left side. That registration example for the rules matrix of plan codes that you use in registration. This is a nice example. If you can aggregate, if it's a registration task and you can aggregate the rules, and then you can configure your real-time eligibility system to looking at the 271, the eligibility responses, and picking out the elements that would determine, is this the blue managed Medicaid product, or is it the managed Medicare product, or is it the commercial blue? Because those are how you choose your registration codes. If you can capture that rules matrix and use a configuration manager, what you've done is you've taken something that was hard to automate and made it easy to automate through configuration management. Another example will be if you do what I'm suggesting about mapping out the workflows and picking which tasks are relatively easy and inexpensive to automate, and you hear the term human in the loop today. What you can do is you can automate step 1, 2, and 3, kick it to a person to make the decision at step number 4, and then you can have the system complete step 5, 6, and 7. This is called attended automation, or now human in the loop is the more common term for that. Okay, it's a nice framework for selecting use cases. Let me give you a couple of use cases we'll go a little bit deeper on that I think are high value, high return on investment type. My personal favorite use case here is clinical appeals. In general, things only deny for clinical reasons where they're expensive. In general, you're going to be digging through the medical record. It could be tens of pages. It could be more than 100 pages of medical record, so it's very time consuming. You really want to win these things on appeal because it might be a $100,000 claim at stake here, so it's really important. The The reality is, reading 100 pages of medical records is actually quite easy for an LLM to do. Taking an insurance company's policies around a particular procedure, it's actually a really easy thing for a language model to do. Okay, so my advice here, let's go map the process. I know this is an oversimplification, but you get the idea here. Let's first make sure we understand that underlying root cause, go examine the remittance, and understand exactly the root cause. If I don't address that, probably not going to win on appeal. We talked about, let's go get the applicable policy for this disease or this category so that we understand what the payer's requirements are. Let's go read the medical record to understand, is there sufficient documentation to support that we met the rules? I've got a yes/no here decision on should we write. Here's the answer. Yes is the answer. You should appeal absolutely everything. It's just a matter of how strong you want that appeal to be written. You write your justification, and then you assemble the cover page and the attachments with your evidence, and then finally you get it to the payer, snail mail, upload it to a portal, etc. Go down to the department, watch people do this, take your clipboard, watch people do it. I put my little icons. How easy is it to automate this task? The good news is today, these language-based tasks, these are ones that don't require a lot of judgment. They require reading lots of pages of text. So this is actually a fantastic use case for automation today with LLMs. And so you can save a lot of time where you couldn't before. So there's a place that my comment about use the whole toolkit, don't just use the hammer. There are different types of tasks, there are different types of automations for the different steps of the process, and you should be using a system that incorporates all of those. If you want to automate the process end to end, you need to pull together the RPAs, the LLMs, the business rules matrix. All of those things need to work together. It's a great use case. This is the breakdown you should be doing when you're evaluating which use cases you want to do. Get your clipboard, go down, build a model. We talked about automation gain. Before you actually spend the money on your engineering team building a product, before you spend the money on a vendor who's got a thing, make sure you do your analysis. I just throw this up as an example. If you want a business case tool around clinical appeals, I'll give you the Excel and you can use this thing. But the point there is to have one. Okay, just to make sure I'm hitting both the mid-cycle, the back, and the front, let me do one more example here. Go watch your authorizations team. Go through the process. We have to determine, does this scheduled service require an authorization? I'm going to go look in the chart. Do I have the requirements that this payer requires? Can I document it? I got to get the request to the insurance company. I got to wait a little bit of time for the insurance company to approve or deny the authorization request. Depending on if it was approved or denied, maybe there's a feedback loop, etc. Finally, after the services are rendered, I got to make sure that what services actually were rendered matched what we had the authorization for. Go watch your teams, which some of these cases are great for business rules matrix. Some of these tasks are great for LLMs. Others you can use bots, etc. And this is another great use case. There have been firms trying to automate these steps actually for a dozen years at this point, and they've mostly focused on the most left, getting your requirements captured, or the furthest to the left, was the authorization approved, yes or no? My argument here is we now have the new tool with LLMs. We now can look in the medical record, look at the payer's policies, and do that chart audit, that comparison. So the next set of tools to come out from the industry should incorporate those steps, and this is how you can get much further along in your automation gain pursuit. Okay. The only thing I'm going to say on this, if you want more on this, come find me on LinkedIn or whatnot. We could talk about these things in more depth. The one I want to talk about here is I talked about agentic. I talk about the like chains of thought. I think as far as I want to take it today is the agentic is not ready. What you should be doing today is you should be using AI today to do the tasks, to automate the tasks that are very time consuming and highly language based. And you should be having your most skilled people making the judgment calls and the decisions on the steps that need to be done. My argument is that the full agentic automation just simply isn't ready yet. And so if you're pursuing these things, you just need to have your eyes wide open. We can go through the different techniques here another day. Let me just land this last point here that for about 2 years now, there's been this debate. What is the actual definition of artificial intelligence? To me, it's actually really simple. It's just a simulation of human intelligence. And the point here is that it isn't actually intelligent. It is a simulation of it. And so you just need to know the limitations as far as those go. There's lots of use cases. Here's my cheat sheet. I'm happy to distribute these slides if you want them. There's lots of other use cases. I think I would just say that the use cases you should be pursuing today, where you'll get the most automation gain, the most value add, are the use cases where people have to read a lot of text. If you are comfortable, if your organization was one that's on the leading edge and comfortable, the voice agents have gotten really good because voice agents, it's just text in a different mode. And so depending on how comfortable your organization is on having agents make phone calls, et cetera, I would argue a canned recorded message saying, here's your instructions for where to park tomorrow morning, or the reminder to fast, or whichever instruction. I would say it would be better to have an agent give those instructions than a pre-recorded. If it needs to be a conversation where there is a decision tree and you are asking for information back from the patient, I don't think the agents are quite ready for all of those circumstances. I know you guys do some of this kind of stuff.
Yeah, we do a little bit of this. Sorry. Yeah, we do a fair amount of this right now, and we're kind of diving into it a little bit as we go. I'm trying to think of how I would really navigate into that. Give me a moment.
We'll come back to it in a second.
Back to that. I'm going to get there.
Let's get to Q&A here. I'm just gonna wrap it with this. Any Blackhawks fans in the room? None? Any NHL fans in the room? Okay. All right. Well, I'm going to tell you the story. I'm from Chicago. I'm a diehard Blackhawks fan, so I need to tell you the story. A couple of years ago, the Blackhawks, because they're so bad, got the first overall draft picked. And they picked Connor Bedard, who's supposed to be this up-and-coming phenom, the best hockey player since Wayne Gretzky. He's coming. He's great. And so the Blackhawks drafted him. Here's the problem. He was 18 years old. So when they put him on the ice at 18 years old, he's not even fully grown. He's only played the game for so many years. And they put him up for his opening face-off against Sidney Crosby, one of the Mount Rushmore of hockey players of all time. When they put him up on the face-off, he got knocked over. Like, he literally got knocked over on his first face-off. In this picture, he's wearing the bubble because he broke his jaw in his first year. And so here's what I'm saying is that this kid, he is the next thing since sliced bread. He is going to set new records, and he's going to be the best player in the league in another 5 more years or so. The problem is, today he's only 20 years old, and he only has so much experience. And this is kind of where we are with AI. The hope, the promise, you are going to have a self-driving car at some point in the future. It's just coming slower than you want it to be. This is an actual picture that is me banging the glass behind him. He scored in his rookie year.
Yeah, is that AI generated?
Nope, it's me.
Okay, just checking.
Not AI. That's me. He scored an overtime goal and won the game. Won the game in overtime, and everybody went bonkers. He saw me, banging on the glass and came and skated over to get a selfie with me. So I gave him the picture, so I signed it for him and everything, so you can keep the memento and all of that. So, all right, let's take questions. I said a lot of words quickly. We'll take it where you guys want to take it.
Thank you for the presentation. That was awesome. So where my mind is going is I'm thinking as a CFO, I have a finance team. They spend a lot of time doing research, right? And so I have a tool that shows me, where my incremental overtime is by employee. But really what I want is a system to just say, I've already looked at the data. Here's where the problem is. Here's where you need to go, go have conversations, right? Versus me having to wade through multiple sets of data to figure that out, right? And so thinking in terms of how we approach a partner in that space to say, okay, here's the problem I'm dealing with. How could we use technology? And I don't even know if we're there yet in some of the financial reporting areas, but to me, that's where I think these tools will be so valuable to reducing the cost of labor. But how do you engage in those conversations? Are people already thinking about this? Where do I go from here?
Yeah, first question's a hard one. I don't think AI is the answer here. I think part of the problem you described was access to data, having the data collected together. I don't think there's a ton of... Epic has a ton of data. It has all of the data. And it has different tools and different decision support type tools. And there are different avenues. I would say that's a matter of traditional business intelligence kind of activity. And so I think part of the question is, how do you go from business intelligence to AI-enabled business intelligence? And certainly there are tools coming. Certainly you can engage with a ChatGPT or whatnot. You can feed it information. You have to guide the AI. And it can be quite interactive. If you say, here's a problem, I want your assistance feeding. I skipped my lessons learned. I can't stop talking without saying, do not copy and paste any PHI into Grok when you leave this message. So you shouldn't be copying, pasting your Epic reports into ChatGPT. Talk to me later if you need help getting configured, but you can set up Copilot inside your organization so that you can embed PHI and whatnot. But this is what you can do today, is you can say, I want to focus on a specific department. I want to focus on analysis of if I'm deploying headcount the right way. And you can feed in either reports that are visual or the underlying data, and you can have a conversation. What you will get back is not a healthcare specialist, but if you give it more context, it will help you think through kind of in a prioritized way. It will give you advice that... Raise your hand if you're a consultant in the room. Hey, you guys need to worry about your jobs. But what it will do is it will basically be equipped with the same kind of decision and thought process that a consultant will have, and you can interact with it very, very well. If you're a consultant, the question about are you saving 3 hours a day, you need to go much quicker on this, because consultants are going to be eaten by AI quicker than other places, because the discipline of here's how we run a playbook, you can get that from ChatGPT.
Yeah, I was going to add, you asked me a moment ago and I completely blanked, but I actually can speak to a little of that. At OHSU, without plugging a vendor or a system that we use, in the ORs, we have a third-party system that we utilize for all of our data metrics for the OR, and it now has an AI capability to it, where rather than in the old days where we would have to pull all this data, look and see where should we reassign block time, we can just ask it, right? And it tells us what are the top 3 opportunities that we have, and we can make decisions off that, and we do, which is helping immensely with just getting additional growth into the hospital.
That's a specialized system, right?
Yeah,
like that
absolutely.
system, there are data inputs to enable it, and then it has its own set of context and its own set of specialization around it.
Yep.
Your Copilot isn't going to have that. Your ChatGPT isn't going to have it. There's going to be increasing amounts
You'd have
of
to plug it in
point
then.
solutions.
Right.
Yeah.
Yeah.
And so, Epic has their whole AI suite. It's well over 100 use cases that they're pursuing. These point solutions are going to get better over time. And I would just say that on my continuum of complexity, the more complex, the longer you're going to have to wait for AI to help you, and the less good that assistance is today, the more simple the task is that you're feeding in, the better and more readily available it's going to be.
I think we have time for one more question.
Perfect.
So you guys talked a little bit about agentic AI and how it wasn't ready. I mean, I do think it's ready if you define the problem a little more narrowly, like go find me an appointment time in the afternoon, and then I would say always have an exception path. So I tried to make a follow-up appointment for my son, and they're like, oh, there's no appointments for the next 3 months. You want to make that? I'm like, no, we're supposed to follow up in 2 weeks. And it took the doctor coming over saying, yeah, book them in this slot. We'll get it done in this 20-minute slot instead of a 40-minute slot. I mean, at times the systems are just following their rules. They can't help it.
Awesome with a specific use case. There's a broader point and a specific point. Here's one of the broader points. Just like 10 years ago, when people started using predictive models, they called it AI. And then just like 8 years ago, when people were using bots, they were calling that AI. This product, people are calling it agentic AI. It's not an agent, because it isn't actually making the decision about which slot should I put them in. What this is, it sounds like it's AI enabled, and it's great. It's way better than not having the solution. What this is there is a specific workflow. I look for open appointment windows. I have a description of the type of appointment. Does this fit into one of those windows? I'm equipped to make the decision about should I slot it in here. So this is a system. There is a dedicated workflow, and it has rules about what it can do and what it can't do. It is not the agent in the cloud that's going to go solve all your problems. It is a dedicated system. I think these things are all right. I want to make one more point, and then we'll get off the floor here. But one more point on this. Let me use character recognition as an example. When is character recognition going to be good enough? When is image recognition going to be good enough? And we've now come to a point where we pretty much accept the character recognition it still makes errors. It's something like 98 point something %. And over time, it went from 60% to 75, and then 80, but it's approaching a limit, and it is not going to be perfect. It's getting better and better. We are in a mode where the LLM stuff is not perfect. It is going to continue to get better, but it will never achieve. And so this is how you decide what you can do and what you can't do. If you are acceptable, if the error rate of this process is acceptable to you, if it's in line with the type of error rate that you would have by just having people do the task, you should move forward with it. And then the reason I say it's not ready yet is that the generic agent today makes more errors than a person. I use the example of booking travel. I am not comfortable with the error rate to give ChatGPT my credit card. I'm not at that point. I do not trust it with PHI. I do not trust it with making decisions about what diagnosis codes can go on a claim. I don't trust it for, there's a variety of things that the threshold is higher than what the tool, use the hammer to hit the nail, don't use the hammer for what it can't do. All right, I'm on LinkedIn. Friend me if you want to talk about this stuff more. Track me down. Happy to do it.
Nice work.